This may sound strange, but fungi live in several places in your body. The yeast that you have living in your mouth, digestive tract, and vagina is called Candida or thrush. A lot of women have at some point in their lifetime experienced itching down there. But no, it's not because we are dirty or we have a poor vaginal hygiene. In fact, it can even be caused by overwashing the vagina. As many as 3 out of 4 women may experience vaginal yeast infection once in their lifetime. Come here. Vaginal yeast infection is not a toilet infection, neither is it a sexually transmitted infection, but it is caused by the overgrowth of these fungi in your vagina. Today, I'm going to be explaining what vaginal yeast infections are, discuss common causes, symptoms, reoccurrences, risk factors, prevention and treatment of vaginal yeast infection. So if you are someone that has been battling with vaginal yeast infection, you need to watch this video to the end. Hi, welcome back to Healthy Living with Farm Kene. If you are new to this channel, hi, I'm pharmacist Kenechukwu Okoye. Here we talk everything about health. If you are interested in this kind of content, please click on the subscription button, like this video, and turn on the notification bell so you get notified whenever I post a new video. And if you're a returning subscriber, I'm saying thank you so much. Let's get right into the video. What is a yeast infection? Yeast is a fungus that lives on the skin, digestive tract, mouth, and on the vagina. Every normal human being have what we call the normal flora. And this normal flora is the number of microbes that is present on different body sites of a healthy individual. When yeast growth increases, it causes symptoms of vaginal infection known as vulvovaginal candidiasis or vaginal thrush. When this yeast is imbalanced within your body, it does not cause any infection. You are safe. But once there is a distort in the number of this yeast or the bacteria, that is when an infection occurs. So what causes this yeast infection? The fungus Candida albicans is responsible for 85 to 90% of vaginal yeast infections. Excessive growth of this fungus occurs mostly in warm and humid conditions, and that is why the mouth and the vagina is usually where this yeast infection occurs the most. Although yeast is normally present in the vagina, when the normal healthy bacteria called the lactobacillus decreases, this yeast finds an opportunity to thrive. Let's talk about the symptoms. How do you know that you have a yeast infection? One of the things you would notice when you have a vaginal yeast infection is a thick white vaginal discharge with a clumpy consistency. Another thing you would notice is an itchy or burning sensation in your vagina or vulva. Also, you would notice redness and swelling in your vagina and vulva, and this is due to inflammation. And then there will be tiny cracks in the skin of your vagina because of the fragile skin around that area due to this infection. You may also experience a burning feeling when you pee or even pain during sexual intercourse. So let's talk about risk factors. What are the factors that can encourage these yeast infections? First one on the list is pregnancy and hormones. Anything that changes your hormones can distort your normal flora, and that means there would be an overgrowth of these yeast infections in your vagina. During pregnancy, your estrogen levels are very high, and studies have shown that high levels of estrogen can lead to high risk of thrush, and that is why pregnant women usually come down with yeast infections. Other things that can change your hormones are birth control pills and even normal changes during menstrual cycle. Then the second on the list is antibiotics abuse or taking antibiotics for a long period of time. Antibiotics that you take to treat infection also kill the good bacteria in your vagina. And remember I said that the good bacteria help to keep the yeast in check. These antibiotics, they don't only kill the harmful bacteria, they also feast on the good ones. That means once there is a distort in the number of healthy bacteria in your vagina, this will give the yeast more room to thrive and therefore causing a yeast infection for you. This is why it's very wrong to take antibiotics when it's not prescribed for you by a health professional. The third one is having unmanaged diabetes or being obese. The fourth one is having a weakened immune system. If you have a disease like HIV or AIDS, your medications can suppress your immune system. Chemotherapy and radiation treatments for cancer patients can also suppress your immune system, thereby increasing your chances of getting a yeast infection. Then let's talk about reoccurrence. Why is it that yeast infection seems to be very difficult to treat, or it keeps coming back even after it's being treated? The major causes of reoccurrences are poor hygiene, weakened immune system, antibiotic abuse, douching, or the initial infection wasn't properly treated. So moving further, let's go into the prevention. What are the things you should do to prevent coming down with yeast infection? Avoid the use of feminine deodorants. Don't use scented tampons or pads. Use only water-based lubricants. Wear cotton underwears or loose-fitting clothes. Keep your blood sugar levels in a normal range if you have diabetes. Moving further to treatments. How do you treat yeast infection? Antifungal medications are used to treat vaginal yeast infection, and these medications are available in the form of oral tablets, vaginal pessaries, and creams. These medications work by fighting yeast overgrowth in your body. An example of this medication is fluconazole, which is an over-the-counter medication. A very important thing to note is that if you are treating vaginal yeast infection, it's important you avoid sex until you finish your treatment, because sex can cause more irritations. We've come to the end of this video. I hope you enjoyed this video. If you did, please subscribe to this channel, like this video, and leave a comment below. Thank you very much for watching.